Hey everyone, quick update you need to hear. San Diego based Sharp Healthcare just announced that they're laying off 315 employees.
Just a reminder that you can't work in healthcare, be a nurse, be a provider.
Hey, you guys, I am literally inside the US Senate right now, but I have to come online and talk about this. Most of the hospitals in Southern California have been on a hiring.
Well, second time in a year, almost a year to the day, I got laid off again.
Right on the heels of National Nurses Week, New York Presbyterian Hospital has announced its plans to lay off about 2% of its workforce, which equates to about 1,000 employees.
Why doesn't anybody talk about how hard it is to show up to work after they announce that they're doing layoffs?
The rate of massive layoff of nurses is really becoming alarming, and honestly, it is no longer funny seeing people's career being taken away from them, seeing people, oh my God, I really feel so bad for them, and I pray for a lot of things to just come very easy, because honestly, a lot of people are going through a lot. Oh my God, it is so much, guys. Anyways, hi guys, welcome back to my channel. Let me just go ahead and play some of the few clips for you so that you can actually hear from people's opinion. And trust me, it is no longer funny. So let's just watch and let's get some stuff, okay?
Hey everyone, quick update you need to hear. San Diego based Sharp Healthcare just announced that they're laying off 315 employees, which is about 1.5% of their workforce. This includes senior executives and roles in medical information and marketing. So, what's driving these cuts? According to Sharp, the rising cost of healthcare is outpacing revenue. They are also facing state-mandated seismic upgrades and poor reimbursement rates from payers. So bottom line, they say they can't keep up with the economics. Here's what else is changing. Some staff will see reduced hours and others will be moved into adjusted roles. Sharp says the majority of cuts are in non-clinical areas, so direct patient care won't take much of a hit. Leadership is also fearing the squeeze. Senior execs are taking a 15% pay cut, and the CEO, Chris Howard, is trimming another 10% off of his own salary. So now Sharp is offering severance, extended health care, and career transition support for those impacted, which is better than what some other systems that I've reported have offered. But still, this is a signal that no health system is immune, especially if you're in a non-clinical or even in an administrative role. If you're a nurse or allied health professional thinking your job is secure just because you're not at the bedside, this is your warning shot. So let me know, definitely in the comments, are you seeing cuts at your facility too? And if you're in a non-clinical role, are you making moves to protect your career?
Just a reminder that you can't work in healthcare, be a nurse, be a provider, and have an ounce of racism in you to provide great patient care.
Right on the heels of National Nurses Week, New York Presbyterian Hospital has announced its plans to lay off about 2% of its workforce, which equates to about 1,000 employees. Don't know yet exactly what the breakdown of those employees is going to be, but we do know that it includes nurse practitioners and nurses. They are allegedly laying off all of their nurse practitioners except the ones that were hired before 2010, and have allegedly already laid off 50 RNs from the Columbia campus, from what I'm told. But are they not still building a new cancer center and enlarging another hospital? But they're citing financial difficulties. Why? Why are they having financial difficulties? That's a great question. I'm glad you asked. Last week, Columbia University and New York Presbyterian Hospital announced that they have settled a massive class action lawsuit for $750 million involving 576 patients that have accused an OBGYN by the name of Dr. Robert Hayden of sexually assaulting them between 1987 and 2012. But wait, it gets worse. According to federal investigators, Columbia University knew about this for years and years and continued to allow the OBGYN to work for years as patients continued to come forward. Finally, in 2020, federal investigators began investigating, and they have alleged that Columbia University failed to inform the DA when more patients continued to come forward and that they withheld evidence. And to date, as far as anyone knows, no one with Columbia University and New York Presbyterian, none of the employees there have been terminated or resigned in the wake of this. He was finally sentenced in 2023 to 20 years in federal prison, thank goodness. But Columbia University, they have not had to admit any fault whatsoever. But they're now paying out $750 million in settlements while they let him continue to do harm, to actively harm patients. And now, as the trickle-down effect, nurses and nurse practitioners and other healthcare professionals are being laid off. If that doesn't piss you off. The epitome of corruption. And this is not an isolated incident. Stuff like this happens all the time. They always cover it up, especially when it's a doctor.
Where do you guys think this is actually going to take us to? Because honestly, I have a lot of clips that I've not even played for you guys. If I start playing over and over, you start hearing people's opinion, you will know that a lot of people right now don't even know where their fate is, like, at all. Oh my God. Where was the American we usually know? What happens? What changes? Jesus Christ. I don't know right now, but I just want you guys to let me know in the comment section. What do you think is really happening in this phrase? What do you think? Do you think that this thing is going to end soon? I really need to know from the comment section, because from the comment section, we're going to be picking some one or two opinion that we are going to be using, and other people can actually get some strength from there. I don't even know how to express myself. Like, I've never filmed a video that is this emotional. Honestly, seeing people being laid off their job is like seeing something being taken away from you. Anyways, let me just continue the rest of the clips for you guys. Oh my God.
Well, second time in a year, almost a year to the day, I got laid off again. Twice in a year. And what the fuck? What is anyone supposed to do? And they said, because of the economy is crap right now, so we're gonna lay off a whole bunch of people again. And I already was struggling so hard, actually low-key, to even keep the current roof over my head. And now I have no idea how I'm even going to get through the next few hours. I just don't understand. But yeah, the economy is shit. America is shit right now. I feel like there's a really big plan for them to, tank this so that we have to rely on other things, other people. It's fucking shit. And I'm quite frankly tired of it. I'm tired of my livelihood being in other people's hands. And I have no idea how to fix that. But I'm going to, because this is just wild. And I'm fucking angry more than I am hurt or sad. I'm scared. I have no idea where any of my bills are gonna come from. The money. I'm more angry than anything because I just cannot even believe I used to be able to get a job like the week later if I got laid off. So I have no idea what's gonna happen, and I was really hoping at one point I would make money on TikTok, and I still only have 1,500 followers or whatever. So If you could just like, I don't know, blow this up and let's get 10,000 followers plus whatever. Because I might be homeless in a week or two if I can't figure it out. So, yeah. I hope everyone is having a great Tuesday, a way better Tuesday than me. And if you have any tips, tricks, or whatever to help right now and get me through this, greatly appreciated. Yeah.
Hey, you guys, I am literally inside the US Senate right now, but I have to come online and talk about this. Most of the hospitals in Southern California have been on a hiring freeze for months now. However, University of California, San Diego sent out an email to all staff yesterday that they were laying off 230 healthcare workers. They said in the email that this has nothing to do with performance and is entirely because of budget cuts. That's right, you guys. California hospitals are laying off healthcare workers because of the potential budget cuts in the big, beautiful bill that Republicans are trying to shove through Congress right now. We're already feeling it. We are already feeling it. And we are going to continue to feel worse. Reminder, this bill has not passed yet. However, the hospitals are acting preemptively and firing healthcare workers. This is bad. This is bad for you. This is bad for your mama. This is bad for your grandma. This is bad for everyone. This is bad for nurses. And we have to fight against this. And what that means is calling our senators. The bill passed the House of Representatives. That means it is now up to the Senate to decide if it goes further. So we have to be calling our senators as much as we can or emailing them. Shit, I'm in Washington, D.C. This is the people's house, okay? You can just show up here. Knock on an office door, okay? Republicans want to cut $1 trillion. $1 trillion from Medicaid and another $500 billion from Medicare. These cuts are going to directly affect us, and they are already affecting us, and the bill hasn't even passed yet. Laying off nurses, laying off healthcare workers, laying off hospital staff is bad. It means shittier care because, simply put, we can't be everywhere at once. It means longer wait times for care in the ER. It means higher costs. It means our entire community suffers. As a nurse, I cannot tell you how serious this is. I cannot tell you how sad it is that 230 healthcare workers at University of California, San Diego are now not going to know where their bills are going to be paid from because that hospital has preemptively cut staff because of these potential budget cuts. We have to fight for our communities. We've got to show up, call your senators, knock on their damn office doors, email them. I don't give a shit, girl. Just get a hold of them, okay? We got to stop this bill. We got to stop this fucking bill. We got to protect Medicaid. We got to protect Medicare. We need to expand, actually, both of those programs, because if we don't, our communities will suffer. The only reason they are doing this is to create tax cuts for billionaires. I say fuck that. I hope you do too. And I hope you join me in fighting this.
Why doesn't anybody talk about how hard it is to show up to work after they announce that they're doing layoffs? Like, you expect me to show up and want to work every day at my hardest, even though you may turn around and just say, poof, your job's gone tomorrow? I don't know about y'all, but I have zero, probably negative motivation to show up for this company who every 6 to 12 months threatens layoffs. I'm fortunate that I haven't been laid off at this point, but it's really frustrating when your director's response is, well, you're a nurse. It's fine if you get laid off because you have so much opportunity. Hey there, Joe. No, I don't, because I would rather go stick my feet in a pool of alligators than go back to the bedside as a nurse. I don't know about any other nurses, but I feel like if you've been in it, you know what I mean. And once you've been out of it, you're not going back. So while, yes, I have a nursing degree, if you've been ever a bedside nurse in the last 10 years, you know, there's no way I'm going back. So anywho, I don't know. I'm just feeling frustrated today and very unmotivated to work. And I just don't know if anybody else who gets threatened layoffs feels the same way. So if you've ever been threatened to be laid off, like, did you still show up 100% to work? Because it's not like it matters, right? Anyway, happy Wednesday.
Guys, honestly, things is not becoming funny right now, to be honest. Seeing people being laid off of their jobs, seeing people having to prepare, it's not just a job for me. But some persons personally love this career. And is there even hope of getting another one? Because right now, the economy is shaking, to be honest. I really feel for them, right? Like when you, oh my God, I don't even know what to explain, to be honest. Let me know in the comment section. Have you been affected in one way or the other because of this economy right now in America? Let me know, guys. Whew. We just have to keep praying for grace, because right now that is the only thing we can be praying for. Grace. Grace is ordinary. That's just the honest truth, right? Okay. Let's continue this video.
Well, second time in a year, almost a year to the day, I got laid off again. Twice in a year. And, what the fuck? What is anyone supposed to do? And they said,
oh my God, I can see pains in the eyes of people. I can see people really, really, really trying to struggle to just put yourself in there. But if you are among those that will be laid off or that is already laid off, I just want to tell you that you don't need to give up on yourself. You don't need to give up on the career. You don't need to give up on you. Just try your possible best to look out for other things that can actually work out for you. And I just wish you guys good luck, honestly. Let me know in the comment section if you are an American resident. Let me know in the comment section, how are things been going with you? How are you been coping? How is literally everybody? Okay, because a lot is really, really happening. Anyways, if you have not subscribed, do what? Subscribe, like this video, drop me your comments. Lastly, do not forget to share for every other person to get this good news. And yes, with no further ado, I'm going to be saying bye, and I'll see you guys in my next one. For now, bye. I love you guys. Mwah.